So I'd just like to briefly start my session this afternoon by letting you know the outline of mental status is as much the responsibility of a patient, depending on their age, as well as the family who's supporting and nurturing that goal. So we obviously encourage things like nutritionally dense food, limiting junk food, limiting foods that are high in preservatives, highly processed. We do have this general sort of motto out there: if you can't eat your nutrition, if you're not feeling well enough to eat your nutrition, then drink it. Nutritional supplements are out there, and I'm sure lots of you have tried a variety of nutritional supplements, and so there's different strategies and ideas to help improve that intake. And there's also supplements out there on the market to help ensure that you're meeting your nutritional needs. So with respect to dietary strategies, I'm sure there's a lot of questions around what can I eat, what should I eat, how is IBD affected by diet? And as it currently stands right now, to my best knowledge, there's no scientific evidence to support that foods cause or trigger inflammatory bowel disease and the flares. So what we do understand of inflammatory bowel disease right now is that there is a genetic component and that there is an environmental component to it, and we can certainly enlist food as an environmental component, but what we can't do for you right now is actually identify a food group or a food type that may actually be influencing the disease. So what we do advise and what we do encourage is that if you are in remission, you should follow a healthy eating guide, and the one that we recommend is Canada's Food Guide to Healthy Eating. So this generally refers to your 4 food groups: your grains, your fruits and vegetables, your meats and alternatives, and your dairy group. And depending on the age and the nutritional needs, so for example, an adolescent male is going to have different caloric and nutrient needs than a 5-year-old young boy, but to eat adequate nutrition from all 4 food groups that's needed for that particular gender and age group. The one thing that we do know is that diet, however, can help manage symptoms should someone be in a flare. And this relates back to the initial slides that I had showed with respect to the gastrointestinal tract and the role of each different part of the body, and how food passing through the gastrointestinal tract can have a role with gastrointestinal symptoms during a flare. So one of the questions I get asked frequently, and is a segue into this slide, is fiber. Should you eat fiber? Shouldn't you eat fiber? How much fiber is too much, and what kind of fiber? So fiber essentially is a type of carbohydrate that doesn't get digested and is not absorbed in the human gut. And so in the general healthy population, it's recommended that we eat fiber, and we encourage a lot of fiber because it helps keep you regular, and it helps increase bulk or matter of the food matter in the intestine. So what it does is it makes you feel full longer so that you don't eat as much, particularly if you're an adult and your caloric needs aren't as high as a child or an adolescent who are growing and developing. So what we do know is that if you are flaring, one of the things you may want to do is reduce your fiber intake. So fiber being something that is not digested easily and or doesn't get digested at all or absorbed is something that then gets passed into your stool. So if you have Crohn's disease, particularly small bowel Crohn's disease, and you're in a flare, then the tissue may actually be inflamed and enlarged, making the size of the tube or the size of the small intestine smaller, therefore making it harder for food to pass through. So one of the things that we may recommend is to follow a lower fiber diet so that you can reduce the risk of obstructions and blockages. So it doesn't relate to being fiber a trigger or that fiber is bad in the diet. It's more related to the fact that you wouldn't want there to be an accumulation of undigested food matter there, which could potentially cause pain and discomfort. So high fiber foods are things that tend to be otherwise recommended for the general healthy population as being good, right? Which is why it's confusing. If everyone's telling me to eat brown bread versus white bread and brown rice versus white rice and lots of vegetables, why am I coming to the hospital and the dietitian saying you may want to limit some of these foods? High fiber foods tend to include not just your brown starches, but it could be the peels of fruits and vegetables. It could be the seeds in fruits and vegetables. I'm sure some of you may have had experiences with passing popcorn or passing corn kernels or passing strawberry seeds. These are all considered to be fibers and high fiber foods that you may want to limit. Another dietary strategy that you may want to consider is limiting dairy intake. So dairy as a food group is very, very nutritious and very, very important, particularly to children. It is a source of calcium, it's a source of vitamin D, it is a source of vitamin A, it's also a good source of protein, so it's very, very important in the diet of a growing child. However, there are ingredients or constituents of dairy that some people who have IBD may find problematic. One of the things is lactose, which is a naturally found sugar in dairy. So lactose is otherwise known as a disaccharide. This means that two simple sugars still bound together to form lactose. Glucose plus galactose makes the sugar lactose. And in order for us to break down the sugar lactose, for us to absorb the simple sugars, we need an enzyme, and that enzyme is called lactase. Our small intestine makes this enzyme to help break down this sugar. So if someone is flaring, they may not be able to have enough lactase available to break down that lactose. And if that lactose is not broken down, it really doesn't readily get absorbed, which means that then it passes through the small intestine into the colon, where it becomes a food source for bacteria. When bacteria eats on this sugar, it produces gas as a byproduct. It can also cause some bloating, and it can cause some flatulence and discomfort. So some people find it helpful to actually limit the amount of lactose in their diet. I focus on the word lactose because different dairy products have varying levels of lactose in them. So as opposed to actually eliminating or restricting the entire food group, being that it's an important food group, you may just want to reduce your lactose. So things like purchasing lactose-free milk or low lactose yogurt, purchasing hard-aged cheeses as opposed to creamed, soft, ripened cheeses. Things like Parmesan and butter, which are low in lactose, can probably still be kept in the diet as a way and a strategy to reduce lactose. The other question I frequently get asked is around supplements. So when do you supplement and when do you not supplement, and should everyone be on supplements or not? So a general recommendation is that if you're not eating well and or you're not able to follow Canada's Food Guide to Healthy Eating, you may want to consider a nutritional supplement or drink. So there is a new protocol that we've started here at the Hospital for Sick Children in our IBD program, and that is that we encourage and strongly recommend that all children with IBD take calcium. We recommend 500 milligrams daily, as well as vitamin D, and that's 400 international units daily. And so we came up with this recommendation because we found that the dairy intake of our patients was inadequate with respect to meeting calcium needs. And given the fact that we live in Canada, and we all know we don't get a lot of sunshine from the months of October to April, May in Canada, vitamin D is a very, very important vitamin for bone health, as well as other health diseases, which is what the literature is indicating right now. And so to supplement the vitamin D in all children with inflammatory bowel disease. That doesn't mean that your particular child doesn't need more of the vitamin or mineral, and that's something we can certainly discuss in follow-up appointments, but this would be across the board. This is probably the last dietary strategy question I get asked frequently, and I thought I could bring it up to the group, and you can certainly ask questions afterwards, is there a diet for inflammatory bowel disease? And what diet should my child be eating? And what's the best diet for inflammatory bowel disease? So as it stands right now, I mentioned earlier that we don't really have any identifying food type or food group that can tell us that it can influence inflammatory bowel disease. So the diets that are out there may or may not actually help your child. The one thing that I do caution is that children with inflammatory bowel disease are still growing and developing. So if you do want to try a diet that's been recommended by other healthcare practitioners out there, you want to be aware that restricting a lot of food or a lot of food groups may actually impact the nutrition that you're able to deliver your child, which may in fact further impact their growth and development. So some diets that I'm aware of can be extremely, extremely restrictive. So not only does it affect the nutrients that are delivered to your child, it may also affect their quality of life. You know, birthday cakes are important, and depending on the ingredients that are available to some of these diets, a birthday cake may not be the birthday cake that the next door neighbor is having, and that's really, really, really important. So we know that IBD is multifactorial, and so what works for one person may not work for someone else. And that's why it's so difficult for there to be any type of prescriptive diet to be given to a patient with inflammatory bowel disease. So you may have friends, you may have family, you may have people that you've met here today that can tell you you can try something with respect to diet, but I just caution everyone to say that it may or may not work. So when we're talking about diet, particularly in general and the population as IBD, we're really trying to focus on meeting the nutritional needs of your child and what they need for their particular growth phase. So I always like to say having IBD is hard enough, and once you start restricting a lot from the diet, sometimes it just makes it a lot harder. So just another thing to consider. So I just like to say food for thought is no substitute for the real thing. And that's by Walt Kelly. And so